Excellent. So we've talked a lot about how we can support our own health. But Erin, you've also got experience, obviously, in being a first responder in a physio sense. And what I want to go to now is that now, how can we as healthcare workers, emergency workers, paramedics, how can we better support what you guys do when we are faced with acute injuries and we're treating patients in that, the first response sense? What are some of the techniques and things we can improve the outcome for these injuries?
Yeah, definitely. So I guess there's kind of, two parts to that. I guess, in my experience, I've also been the first contact practitioner at a sporting event. So, quite often the physios are there on the sideline for the local footy club. And quite often, so we sort of get to the patient first, and then those ones that, might have a significant injury, like a compound fracture or a fracture dislocation, we sort of, we'll get them into sort of an area of safety, trying to mobilise it the best that we can. And then it's definitely getting the paramedics involved to actually transport the patient. So from that sense, we basically just give them the best history that we can. So this is exactly what happened. This is the area that's injured. It has happened that we've had some bad concussions. So if they've lost consciousness, for how long for, kind of just giving the paramedics all that information. So when they sort of get to us, I guess, it works really well if we've got a really clear history, and then we basically hand over to them and we just get out of the way then, because, that's where you guys take over, and that's definitely your area of expertise if that needs to, that patient needs to be transported safely, given some pain relief or whatever it might be. In the clinic, actually, I've only sort of, fortunately, I think we've probably had to call a couple of ambulances. I've only fortunately had to call one in my time. So I had a patient who actually she'd already been to hospital, but she came to me about a week later after she'd had a slip and a fall in a bathroom.
Okay.
So she had a sort of concussion, a head injury, and I'd known this patient for a period of time, but her level of consciousness had decreased, and she was getting quite fatigued and tired. She was slurring her speech. So all of these sort of warning flags that you kind of think, oh my gosh, there's something bad going on. So my experience then was the ambulance, again, just up the road from GCUH, they were lights and sirens, and they were there within sort of 5 minutes just to take over, because we just thought she might have had a bleed.
This is a week after the actual event, the injury event.
Yeah, and then she came to me because she's like, oh, my neck's still a little bit sore, but then just sort of on further questioning, I was like, oh, something's just not quite right here. So fortunately, that doesn't happen a lot in a private setting, but it is good when just to have the ambulance there and so quickly as well. I guess on the flip side, so that's sort of when we're there, and then the ambulance gets there after. On the flip side, if the ambulance kind of are the first contact practitioners, and then that patient may or may not go to hospital, and then we'll see them perhaps in the clinic, it might be a week or two later. I guess, you guys are fantastic at that thing. It's that sort of early immobilisation. I'm sort of more thinking, the high level sort of shoulder injuries or ankle injuries or dislocations or subluxations or ACLs or, all the common sporting ones that we get. It's that sort of early intervention. So that early immobilisation, good sort of early pain relief, simple analgesia, getting them to the hospital, getting them sort of assessed and any images that they need, immobilising it, giving the patients kind of the education in and around what they can and can't do early days. And then quite often they'll come in and see us, whether it be a day or two later, to kind of then start their rehab sort of after they've had sort of the initial management. Yeah.
So in a real general sense, immobilisation is absolutely, the number one critical thing in first response, and then from there, and obviously until hospitalisation, treatment, whatever can be done. So